Last 10 minutes I'll take up with his spouse's occupation. Dr. Bijal is a specializes in mammography.
She's a breast radiologist.
She's a breast radiologist. Okay. Over dinner conversations, what have you learned from her that you can pass on to us?
Oh God! So she is an advocate for breast screening. That is her passion. And she would tell you if she were here that every woman above the age of 45 should get an annual mammogram done up to the age of 75. If not annual, then definitely not less than once in 2 years. It has to be an X-ray mammogram, not a sonomammogram. Sonomammograms are not screening tools, they are diagnostic tools. So I think that's the first and most important thing. The second is that breast cancer today, and I think it's very interesting that for many people now with the advances that have occurred in surgery, radiotherapy, etc., breast cancer has pretty much become like a disease, like having chronic stable angina, or something like that. It is no longer truly a life-threatening disease. Killers is when you have a 25-year-old with metastatic breast cancer, you know this patient is gone. But when you have a 60-year-old with a lump, T1, N0, M0, you know that this is a completely curable malignancy and things like that. So it's also about making sure that people realize that there are so many options and good options now. Let's say unlike with prostate cancer, where there are no good options, right? Every surgery can leave you with some complication or the other that can have a life-changing outcome. But with breast, none of that really happens. So she is also a very big advocate about talking to patients, that talking to patients question, she does that all the time, making them understand what their options are, and also making bridges with the surgeons, the physicians. See, a lot of our oncosurgeons, oncologists don't have the time to talk to patients, and when you establish a rapport with your screening patients, they're coming to you every year, 2 years for the last 20 years, you develop a relationship, and when you find something, you're able to talk to them and make that out. Breast MR has become a big tool. Whenever we see lesions in the breast that are often multifocal or prior to conservative surgery to make sure there is no other disease, then breast MRs get done. And though she's not an MRI person, the only MRI she reads is breast MR, which she is trained for. And so that is one focus thing she does. And then a lot of biopsies and stuff like that, because you need to be able to do that to diagnose cancers.
Forward. What is